Okay, my first question is, where are most acute phase proteins synthesized? I chose the spleen because I misread the word hepatocytes as haptoglobin. I was looking for the word liver as the answer because spleen was also another answer. So I chose the organ that often works with the liver, and I thought it might be where proteins are synthesized. Hepatocytes are the functional cells that make up the liver. They work to filter the blood, manufacture proteins, and synthesize bile acids. Acute phase proteins are proteins in the blood and are part of the innate immune system and help to eliminate pathogens. Some examples of acute phase proteins: C-reactive proteins, fibrinogen, ferritin, haptoglobin, complement proteins. Okay, next. Raynaud's phenomenon is associated with the deficiency of which complement fraction? I completely forgot which complement fractions are used for. C5 just seemed kind of familiar, so I chose C5. The answer is C7. A deficiency in C7 is associated with Raynaud's as well as sclerodactyly and several bacterial infections caused by Neisseria species. All right, which of the following types of automated chemistry analyzers allows for each specimen and accompanying reagents to have their own space? I chose multi-channel analyzer. This sounded like basically an exact definition for allowing each specimen to have their own space. The answer is discrete analysis. This just means that it's using different cuvettes or wells for each sample so that each reaction has its own place. This is what most chemistry analyzers are using. So I understand this from being in the lab and seeing this. 35. Which procedure should be followed when one cross-match unit out of 5 is incompatible at the AHG phase? This one was really confusing to me because I assumed that the patient had a negative screen. So I thought that the incompatible units was maybe due to a clerical error or a technique error. So I chose wash the donor cells and use the wash cells for testing because I thought maybe the agglutination was a false positive due to underwashing. The answer was perform a direct antiglobulin test on the incompatible unit. This is because the issue is with the unit and not the patient or the technique. Positive DAT can happen if the unit has antibodies already attached to them or if they have complement attached to them. The Red Cross doesn't perform a DAT on all units, so it wouldn't be caught before you get it in the lab. Okay, the next question was, which of the following would you find in a primary hyperparathyroidism case? I knew that hyperparathyroid causes increased PTH and increased calcium. I didn't remember how it affected phosphorus. I chose elevated just because the other two were elevated and I knew that. But it's actually decreased because when PTH is increased, more phosphorus is excreted in the urine, causing the serum level to drop. The main purpose of PTH is to maintain calcium levels in the blood. When PTH is increased, calcium is released from the bones into the bloodstream. So when PTH is increased, calcium is increased. Okay, number 8 is approximately what % of the Caucasian population is Rh negative? I remember this number being 20%. I don't know why. So I just had a 50-50 choice between 15 and 25, and I chose 25, but the correct answer is 15. pH alteration of normal blood in a closed vessel standing at 37 degrees Celsius for 1 hour is approximately what? I didn't remember the rate or the measurement, the decrease in pH over time. I just remember that if you let a blood unit sit at room temp, or in this case at 37 degrees Celsius, it will go down. So I don't know, I just chose the second to smallest answer because it made sense to me. So when blood is drawn and it's stored at body temperature, the pH decreases at a rate of 0.04 to 0.08 pH units per hour. Refrigeration allows the decline to slow down, which is why units are stored in the fridge and why they have an expiration date, because this doesn't halt the pH from decreasing, it just slows it down. Which test is not used as a screen for retroviruses in donated blood? I chose nucleic acid testing for HIV-1 RNA. I know that when you give blood, your blood unit is tested for HIV-1 and 2, HTLV types 1 and 2, and then HCV. Because another answer was antibody to HIV type 1 and 2. I thought this included HIV 1 and 2, so I chose nucleic acid for HIV-1 RNA because I didn't think that'd be necessary if the other one was true. The correct answer is nucleic acid for hepatitis C. Hepatitis C testing is an antibody test. Nucleic acid testing is only used to confirm when a positive result is found, but it's not performed on every unit. Okay, which of the following statements about high-frequency antigens is correct? I think this question is really stupid. The correct answer is high-frequency antigens are common, but it is difficult to identify their corresponding antibodies. I chose high-frequency antigens are common, but it's easy to identify their corresponding antibodies. I feel like that's super subjective. I know that high-frequency antigens are common. I said easy because we have processes for identifying antibodies to them. It's not, I don't know, difficult, easy, whatever. So, I don't know, I don't think this one is my fault. And then the explanation explains that it's difficult to find a blood unit without a high frequency antigen. So I'm not really sure. I think that was maybe a mistake. Okay, this question says, a 41-year-old male arrived at the clinic with complaints of fatigue, malaise, and overall discomfort. Upon testing, the patient's CBC results were notably abnormal, with 30% blasts present along with anemia and thrombocytopenia. Bone marrow and cytochemical staining were subsequently performed. The cytochemical stains noted negative reactions to myeloperoxidase and Sudan black, but a positive reaction to alpha-naphthyl acetate. Which of the following conditions is most likely seen? Okay, I knew that both acute lymphocytic leukemia and acute monocytic leukemia are negative for myeloperoxidase and Sudan black, so I was between those two. But I couldn't remember what alpha-naphthyl acetate is for, so I just picked between the two. The correct answer is acute monocytic leukemia because alpha-naphthyl acetate is used to diagnose leukemias with monocytic lineage, so this is the most correct answer. Which of the following is a common cause of febrile non-hemolytic transfusion reaction? I chose bacterial contamination of the blood because I know that bacteremia causes sepsis and it's non-hemolytic. Fever, non-hemolytic. I thought that was the answer. Bacteria in a blood product can cause sepsis, but this is not a transfusion reaction. A febrile non-hemolytic transfusion reaction has a distinct 1-degree temperature increase and is associated with the patient having antibodies to leukocytes in a blood product, which releases cytokines, causing an inflammatory response. Which of the following is most likely to interact with arterial walls, leading to deposition of cholesterol and initiating or worsening atherosclerosis? I chose large buoyant LDL because I thought it made the most sense as what would be the makeup of plaque buildup in arteries. I didn't really remember learning about small or large LDL, so I need to touch up on that. All I knew was that increased LDL causes atherosclerosis. The correct answer is small LDL. This is the most dangerous form because they can kind of seep into the walls of arteries and speed up plaque buildup. This question was asking about E. coli O157H7. It was asking what the O157 refers to. I forgot what O157 means, but I remember I chose F1 antigen because I remember something with F in relation to E. coli O157. I think that I was just thinking about the fact that it has a flagella, and this is F in my head. I don't know. The correct answer is O-somatic antigen. That's what O157 refers to, and it's found in the lipopolysaccharide layer of the bacteria. The H7 part refers to the flagella. Okay, a patient is admitted to the hospital with acute chest pain. Which of the following cardiac markers will be elevated first if the patient had a myocardial infarction? This is kind of stupid. I chose troponin. I don't know. It's the gold standard for AMI. I know it's cardiac specific. I know it's quick. That's why it's used most often. But it's not the first. The first is myoglobin. This isn't cardiac specific. It can indicate damage to any muscle, not just the heart, but it is the first to rise before troponin, which is the second. Okay, which of the following substances is conjugated with indirect bilirubin to form direct bilirubin? I was between glucuronic acid and uric acid for this question. I went with uric just because I remember it being measured in urine, so I guess it would have something to do with bilirubin. It was part of urine output, so I went with that. The correct answer is glucuronic acid. When bilirubin becomes conjugated, it's combining with 2 molecules of glucuronic acid. This transforms it into a water-soluble molecule, so it's more easily excreted in the urine. 91. A 3-year-old girl was brought to the ER with a temperature of 103, lethargy, and cervical rigidity. 3 tubes of cloudy CSF were delivered to the lab. Okay, I chose viral meningitis just because it also stated on the gram stain that there's no organisms present. If you look at everything else, it does point to bacterial. It states that the white blood cell is 88% neutrophil, the glucose is low, and the protein is high. These 3 all align with bacterial I just chose lymphocyte because there's no bacteria found. So the answer was bacterial. Yeah, more signs pointed to bacterial. In the case of a viral infection, the CSF probably wouldn't be cloudy, and it would be more lymphocytes in the white blood cell diff. So, yeah. 94. How many grams of sodium hydroxide are required to prepare a 200 milliliter solution of a 10% solution? And then it gives the atomic weight. So I didn't really remember the calculation for this for sure, but because the atomic weight was given, I was trying to calculate something including that number, when really the calculation didn't need that number. So that's where I was off base. So I went with 40 grams. The correct answer is 20. This can be found by taking the percent concentration times the volume needed. So 0.10 is percentage times 200 milliliters would get you 20 grams. Okay. Areas of difficulty. My lowest area was micro. Chemistry as well. And then level 3, synthesis and evaluation was by far my hardest region for just like in general. Lab obs, urine and body fluids, I'm good on 70%. Hematology also was my highest of like the big 4. Okay, so for my different approach for ASCP questions, I'm going to make sure I read every question, because looking back on all of my incorrect answers, some of them, my issue was that I missed a word, or I misread a word, or there's so many where it's like, which one is false, where which one is all of these except one, and I don't know, I know that I struggle with that, so I need to make sure I do that. And then also, a lot of the questions gave a bunch of irrelevant information, so I need to make sure that I am able to just ignore that, pick out the most important things and focus on those. And then for Media Lab, a lot of them, or most of them, honestly, you could get it down to 2, like very easily. So between 2, that was my issue. So I need to work on eliminating the wrong answers, only looking at the 2 that I think are it, and then finding the best one. And then for ASCP, flagging, a lot of the ones that I flagged on the Media Lab, I didn't even change. There were maybe 3 that I went back to and changed. So for ASCP, I don't kind of just trusting my gut, going with what I think is the answer first, because I'm not going to learn anything with the rest of it. My plan for studying is to schedule my exam in late July, just because I know I need some more time to study. And then I want to try to study most days, and then every day focus on one subject, but between days switch, so that I'm not forgetting what I studied first by the time I get ready to take the exam. I plan on using the yellow baseline book for just like general overview. I think that helped me a lot during clinicals, but then I want to focus more on the BOC book for practice questions, just because it's from ASCP, so it's a good way for me to see those questions. And then just the past 2 weeks, I really liked having to touch on the questions that I got wrong. I think that really helped me. Writing out an explanation for the correct answer also really helps me. So I think that will help me to make sure that the things that I'm getting wrong are not staying wrong in my head. I'm correcting them.